Hey y'all, what's going on? This is Jackie, and today I'm making a video titled "So We Doing This Again?" And in this video, I'm just going to talk about, how all of a sudden we got all these diseases and concerns, health concerns popping up, and I'm just like, really, really. So that is the name of the video. So we're doing this again. So I'm gonna talk about the West Nile virus, the monkeypox, the bird flu, COVID, anything else they don't come up with since I started recording this video 30 seconds ago. Y'all, it's a lot. So the first thing we're gonna talk about is West Nile virus because that was actually one of the first ones that popped up, and it came about because Dr. Fauci was diagnosed with West Nile virus. And they were talking about how Texas has the highest number of West Nile virus cases. And Dr. Fauci also happened to be diagnosed with it. So he was hospitalized for 6 days and he's expected to make a full recovery. The former director of the National Institute of Allergy and Infectious Disease, who led the White House Coronavirus Task Force, lives in Washington, D.C., though it is unclear where he contracted the mosquito-borne virus. And this just shows a map where the viruses were. And of course, it's showing that Texas has the highest number of cases. Florida is there, but it's kind of low. Okay. And yeah. So yeah, I don't think we will really have too many cases. It's been hot this summer. We really didn't have a lot of rain. Been real quiet as far as hurricane season. So yeah, I wouldn't really expect too much down here, but that doesn't mean anything. But yeah, so that was the first. I said, when I heard he had West Nile, I was like, okay. So then the next of the monkeypox. So we know about 2 years ago because I made a video about it, about monkeypox, and how it was a big deal 2 years ago, and that it was mainly found in the LGBT community, and so this time, they were saying that it's back, and then I heard that there was a case down in that there was a case here in Florida. And usually, anytime there's anything like the first COVID case here in Florida, is usually in Broward. And I think it's because Broward is because we had the Fort Lauderdale airport. That's the only thing I can come up with. Now, sometimes it is in Miami, and we do have the Miami International Airport, but I think Broward might be a bigger airport. So that's why you just have a lot more people go in and out through Fort Lauderdale. So maybe that's why it's always in Broward. Usually the first case or whatever is always in Broward. So they were talking about there was monkeypox in Florida. And yeah, no, we ain't doing no monkeypox because I saw what that looked like. But, saw the pictures. But I just heard of one case and then it was gone. It was like it just disappeared. So this article talks about monkeypox and it just gives a whole whatever. And they actually changed the name of it. It's no longer called monkeypox. It's called mpox, right? Because they were like people would get offended because monkey and black people and all this stuff. It like whatever. And so this article is like there are no confirmed cases of the new strain of monkeypox called Claudel and Claudel whatever in the U.S. or in Florida. But then they did say that the Florida Department of Health reportable disease frequency report says that there have been more than 1,800 confirmed cases of mpox in Florida so far this year, as of August 18th. But that the data isn't consistent with the CDC or WHO reports. So they're saying that, yeah, people have had monkeypox here in Florida, but it's been throughout the entire year. Now, we do know that the borders are open. We do know that people are being sent here. Um, I think across the street. the people, it's a white husband. I think he has an accent. And then I think the wife is Haitian, and then they have three, mixed children. And child, I don't know how many people was up in that house earlier this year. I think they might be all gone now. Even though I think it might be some little kids still up in there hiding. But I don't know how many people was up in that house. Like, we really don't know. And I know not too long ago I had went outside to take the garbage out, and one of the guys that was standing there was in the yard yelling in, I guess, in Creole. I don't know if I don't know if he was talking to me, because I looked at him because I had my headphones on anyway. I was taking out the garbage, and he looked at me and he was, oh, I was like, I'm sorry. I was like, if you don't get your ass in that house, okay, you get your ass back in that house, because I don't know what's going on. Okay, if I call the police, shoot. And so did it. A while later, they ended up calling the police, and I think they called it on him. He ain't there. I ain't seen the vehicle, so I don't know what's going on. But like I said, I don't know how many people over there. But yeah, I mean, they here. I'm not saying they got monkeypox down there. I'm just saying we getting people from all over the place. Just coming into America. So no telling. But yeah, I just knew about one case, but then they're talking about, no, it's been more. It's been 1,800 confirmed cases here in Florida. So I'm confused. I don't know what's going on. And then they had a case. This was at Fort Dodge Correctional Facility. They had a, it says mpox, a highly contagious viral disease known for causing severe rash in, I don't know what that word is, has been detected at the Fort Dodge Correctional Facility. It says we're actively managing the situation with robust health measures. Iowa Department of Corrections Chief of Staff Paul Cornelius said in a statement on Monday. Affected individuals are receiving care, and enhanced sanitation and isolation protocols are in place to prevent further spread. So yeah, I don't know what's going on. Like how contagious this is. I just think it's weird that we're not really getting numbers, or we're not getting pictures or any statements just from whether it's the West Nile. They got all these cases. You're not really seeing like what hospital, what area. Like just saying like Texas has. Okay, where at in Texas? Because you know that it makes a difference. Is it Houston? Is it Austin? Is it San Antonio? Is it El Paso? Like where is it? Where are a lot of the cases? Are they everywhere? Like, you know what I'm saying? We're not really getting that from the news. Same thing. You're not getting pictures. You're not getting someone who say, "Yeah, I was diagnosed and thank God," blah blah blah. You're not getting anything. And then same thing with monkeypox. Like I said, I just thought it was one case here in Florida. Like in cases other places, I didn't really care. But Florida, wait a minute, that's too close to home. What's going on? And you ain't get no pictures, no hospital, no nothing. I don't know. I just don't like that we're not getting any specifics. So then that makes me, being who I am, a cynic anyway, you know, just roll my eyes. But don't think I'm stupid. I sure did order some gloves though. Okay, I ordered some large. No, I ordered some medium and large, and I got to go back and get some small and extra large. Don't play with it. Okay, I'm a cynic, but I ain't crazy. So, cause yeah, cause I ain't anybody trying to play no monkeypox. But yeah, it's in Iowa, and like what's going on? Like what's really going on? All right, and then finally we're here. So we're on COVID-19 cases are rising in the US. Here's what to do if you test positive. This article was 3 weeks ago, because that's how long ago I've been working on this. And it says COVID-19 cases have seen a surge in the United States recently, according to the Centers for Disease Control and Prevention. As early as August, the rate of testing positive and emergency room visits were both rising in at least 25 states and only declining or likely declining in three. According to experts, the graph has been similar to previous summers since the pandemic began spreading in 2020. A lot of people try to wish it away, but I think this summer wave is a little bit more expansive than the previous one. And why is COVID-19 rising, doctors say due to increased summer temperatures and hot weathers in some parts of the country, which has already witnessed a lot of heat waves. COVID-19 has seen a uptick. And then it also says, also summer is the time when people go out mostly, congregate in big groups, traveling and having weddings, all in which puts you at the risk of the virus spreading from one person to another. Experts also say since COVID-19 has seen a fall in infections over the last few months, people are not taking precautions. What to do if you have the symptoms? Doctors say since COVID-19 symptoms coincide with those of the flu, it is always important to take a test. However, experts say the symptoms most people experience now vary greatly, which include, and then they just have a list. And it has high fever, cough, headache, sore throat, runny nose, diarrhea, nausea, vomiting, loss of smell and taste, fatigue, and body aches. And let's see. And then it says isolate if you test positive. However, if you need to be around others after a COVID-19 infection, you must wear a high quality, well fitting mask. Doctors say a new vaccine will likely be available in the coming months as the official cold and flu season will begin around the fall. Now, I knew, so I was told by someone who works in the medical field that they were talking about it, that their particular hospital chain was talking, like, so a healthcare system, if I say the name you'll know it, was talking about bringing back the vaccine, like mandatory vaccine for COVID-19. And they were like, either everyone's going to stand together and say no, or everyone's going to stand together and say yes. So no, we're not going to take it, or yes, we're going to take it. So I want to see how that worked. And this was probably about like 2-3 weeks ago when they told me this. So, we're gonna see. Um, I think, I think the healthcare workers will stand together because I haven't really heard pushback from them as far as not taking it. You know what I'm saying? Like the ones, because you had a lot of people who took the vaccine who say they didn't want to take it, even though I don't really believe that. I just think they say that. But I believe that people who took it wanted to take it. Like most people who took it wanted to take it. But I do believe that there are a few that did not want to take it. But I believe most did. And they just say they was forced when they weren't. But um yeah, I think they're gonna stand together and take it. I don't think they're gonna stand together and say no. But I could be wrong. Because the person who was telling me this was like, yeah, I gotta go get mine. I'm like, oh Lord. Say, I got time to play with you. I got time to play with you. Okay. I gotta go get my new one. I'm like, oh Lord. You know what I'm saying? But anyway. So that's what I think. But that's just me. So, and then we can talk about the bird flu. They've been trying this thing with the bird flu for forever, which I still don't understand how we got the bird flu and then killing all these chickens, but we still got KFC still in business. Okay, well, I mean, what's going on? Okay, see, I'm like a type person. I see things, I hear things, and I just be like But you know what I'm saying? Chick-fil-A still in business, even though the chicken don't taste right. I told somebody, I said, I said I ain't eating chicken because the chicken don't taste right. It ain't taste right in like 2 years. And then they after I said that, they was like, yeah, you was right, because they had got some, I think, KFC, and they was like, yeah, you're right, it don't taste right. I said, that chicken ain't taste right 2 years. So something going on. But that's just me. But I go down rabbit holes, so that's just me. But yeah, what do y'all think? What do y'all think about all this that's going on? And then I mean, it was just like too much. First, it was the West Now with Fauci, and I was like, and then it was the monkeypox, and then it was COVID. It was like all three back to back, and it's I don't know if they. And the only thing I just didn't like is I didn't like how We didn't see pictures. You didn't see it. It was just like news reports. You didn't hear a firsthand experience from someone who, or a hospital being overwhelmed with COVID patients. Because even the person who told me about their hospital talking about bringing back the COVID vaccine mandate for the employees, they never said anything about there being, rising cases of people with COVID. I think they only talked about one person that might have had COVID, but that was like one, that it wasn't even their patient. That might have been a patient on the floor, but it wasn't their patient. So, but that's all they said. So I'm like, you know, but it could be just their area. You know what I'm saying? The hospital that they work at. But I'm just saying, I don't know. Other hospitals within that health system, maybe they were seeing a higher, and that's why but I don't know. But they ain't saying nothing about it. But they were talking about the system bringing back vaccine mandates for its employees. So yeah, that's all I got for you. Y'all put your comments below. What you think's going on? Why this going on? Will you comply? Will you not comply? You know, just are you tired? Are you not tired? Do you want a 2020 2.0? Like, I mean, let me know. Put it in the comments below. That's all I got for you. If you like what you heard, seen, don't forget to like the video, subscribe to the channel, and I'll talk to you later.